Welcome to Moments with Marianne. This is your host, Marianne Pastana. We're here today with special guest, Dr. Brian Huber, who's here to share with us the silent crisis of antibiotic resistance in diabetic patients. So is the excessive use of antibiotics really hurting us? Well, today's guest is going to share with us just that. So Dr. Brian Huber is the founder and CEO of Advanced Performance Technology, an Indiana and Texas-based company that has created novel over-the-counter medications to treat wounds, resistant bacterial and fungal infections, and other conditions. Dr. Huber has over 30 years of experience working in the human medical and veterinary arenas. So welcome to the show, Dr. Brian Huber.
Thank you very much. Pleasure to be here.
Well, what an honor it is to have you here and to talk about this. But before we get started, I found your background so fascinating. Can you share with us what even got you on this path?
It's an interesting path because my training in science and medicine was on the veterinary side. However, over the last 28 years, I've been working in human pharmaceutical consulting and business development in the pharmaceutical world, and have been involved with an oncology or cancer care business model in the veterinary side, but also has transitioned into some human oncology business development work. But I really came into this technology, this catalog, a portfolio of products about in 2016. And around early 2017, I committed to acquiring this catalog of products, and especially the lead product we're going to talk about today, which is a topical non-prescription antibiotic ointment that has within the formulation so much efficacy. It's one of a kind, and so it's a pleasure to be able to at least provide information and share how other medical professionals are using this every single day to improve patient care.
And it's such a hot topic right now because we keep hearing about antibiotic resistance and
Yes.
how that's really impacting healthcare right now. So,
Mhm.
how is it that people who have diabetes are specifically really having a tough time when it comes to antibiotic resistant care?
Yeah, so if you have diabetes, and especially if it's, you're having challenges in controlling it effectively, um, you have changes in your body's metabolism, especially in the blood supply or circulation. And where it affects people the most is in the lower legs because, everything's got a pump from gravity does affect it. And the diabetic condition over time will affect the small blood vessels and make them less efficient or shut them down. So we call that microvascular damage. And what that leads to is these pressure ulcers and even a blister that starts out looking like a blister that turns into a huge wound. And diabetic patients have a tremendous problem with foot and toe ulcers and sometimes something called venous ulcers, all in the lower legs and lower limbs. And so we have been very impactful in helping these heal and dramatically decreasing amputations of toes and small toes, big toes. And the challenge, I might add, is that once you have amputated one toe, that particular patient has multiple amputations that occur next. And once you've had a diabetic foot ulcer, you may heal one, but you're going to get another one. It may be on the opposite foot, it may be a different location, maybe a different toe, but it's just a slippery slope that once it starts, the key is early intervention. And right now until now, there's no easily accessible early intervention step without going and getting a whole medical wound care team involved. But now this is what we're talking about with this topical APT3X is that it has the opportunity to stop the process. And as long as it's treated by the patient or the caregiver of the patient, it will actually lead to healing of an ulcer, which is something that's we don't take lightly when we say we will heal ulcers. We're not in the wound management business. A lot of wound care is managing a wound, and it can be managed for months, sometimes years. It's scary, and it's not healed. Well, the good thing about this formulation, when used properly, it will lead to healing.
That is absolutely stunning that we have something like this on the market that we can use that's over the counter. Can you tell us a little bit about the formulation and how this works?
Yeah. So this formulation is unique in that the advanced performance technology is really behind the formulation. If you look at a bottle like this in a as a non-prescription product, the active ingredient is an antibiotic called tetracycline. And that's great. It's very effective. We have empowered that antibiotic to make it, number one, have no bacterial resistance. When we kill the superbugs with this product, that things like you hear called MRSA, which is a bad staph infection, Pseudomonas, some of these big names are chronically difficult wound infections to treat. Well, this formulation does just that in not in hours or days, in minutes. By applying it and letting it do its thing twice a day, it penetrates into the wound. It'll penetrate through scabs and dead tissue, which is important because a lot of these wounds have, dried, almost like scarred tissue around the margins that prevent other products from getting into it where it needs to go. And this formulation also will break through things called biofilm, which is that's where resistance in bugs come from. They secrete kind of a gelatinous wall, so to speak, to protect themselves around themselves. And most antibiotics cannot penetrate through that. And so all of the things this topical formulation does checks the boxes on all of the key attributes for a product that will actually manage this wound. Now, another key part of our formulation, again, I can't take credit for figuring this out, but the gentleman who did was brilliant. We have something called cell differentiation enhancement. And what that means is that we help provide a healing environment, almost like a regenerative healing environment in the wound bed. Along with treating the infection and stimulating the healing process, we can really speed up this healing. And in order to heal a diabetic wound, you have to get new blood circulation and new nerve regeneration in those areas as part of that overall healing process. So again, one formulation does probably what 3 to 4 different medical therapies or added products would be needed to do in a standard wound care setting.
Well, on that note, we're going to pause here for a quick break. We've been speaking with Dr. Brian Huber in regards to the silent crisis of antibiotic resistance in diabetic patients. You've been listening to Moments with Mary Ann. We'll be right back after these messages from our sponsors.
Are you an author, speaker, or expert who is looking for more publicity? Visit radioguestlist.com and sign up for free interview requests from shows looking for guests. Radio Guest List is the #1 free booking resource for radio, podcasts, and TV talk shows who are looking for experts like you right now. Visit radioguestlist.com and sign up today to get the visibility you deserve.
There comes a moment when you realize you're somewhere special. When you discover that each beautiful creature that you see has been rescued from a life of absolute horror and brought to this incredibly free place. Here's where their lives were forever changed and where yours will as well. Discover over 500 tigers, bears, and lions at the brand new visitor center at the Wild Animal Sanctuary just outside Denver. For more information, visit wildanimalsanctuary.org. Discover true freedom at the Wild Animal Sanctuary.
Internationally recognized and award-winning author Judy Goodman works and teaches outside the box of limited thinking. Working with people from every walk of life, her goal is to empower you to be the best you can be, no matter what the challenge is. Born with the gift of seeing beyond our normal vision, she has an extraordinary gift of working with every challenge. Teaching beyond conventional wisdom, her work is described as life-changing. Visit judygoodman.com. That's judygoodman.com.
I'd like to thank Jason Eastwood at Guitarfulness for sharing his inspiring music and talent with us. His music is known worldwide for cultivating atmospheres of harmony, inner peace, and clarity. Visit Jason's website at guitarfulness.com. Join his newsletter, be part of his community, and download his music. Welcome back to Moments with Mary Ann. We're here today with special guest, Dr. Brian Huber, as he shares with us the silent crisis of antibiotic resistance in diabetic patients. So I understand that wound care can be very complex. The healing process can be very lengthy. It can be extremely painful. There are a lot of appointments that have to be done. So how does using T3X help with the wound care healing outcomes?
What's interesting is we have been integrated into the healthcare system, especially we've worked a lot in Puerto Rico and actually in the St. Louis area here in the US. But in Puerto Rico, we've done a lot of wound care and basically validating the product in the minds of the medical community. And what we can see is that in standard wound care, everybody knows who has a wound that usually gets bandaged up very heavily. You don't even see your wound until you go back to the wound care facility. And I know that's good and bad depending on what kind of wound you have. But in the use of our product, we want the patient compliance or patient activity, whether it's the individual patient or a caregiver, to apply the product twice a day. So light bandaging and reduced bandaging is actually advantageous because we want to continue the application of this product. And so what we have seen is that by the medical teams who have accepted the use of this product and see the outcomes, they've also reduced costs on all the other things they have traditionally needed to do, meaning bandagings and all these other, even systemic antibiotics. You got to remember, a lot of these wounds are infected. So today, many people will be placed on oral antibiotic pills, right? They go home with a 4 to 6 weeks course of oral antibiotics. And the problem is, as we mentioned earlier, the circulation at these lower leg wounds is horrible. It's very bad. So you're not delivering the adequate amount of antibiotics by giving it orally or intravenously to a wound site that does not have good circulation until it's healed. So with that said, they also perform, you may have seen the chambers called hyperbaric oxygen. Some people will go sit in those hyperbaric oxygen chambers to help oxygenate the wound site. And they'll do that every 3 days a week, as part of the healing process. And there's some value in that. But our formulations being used in every single case in the hyperbaric chambers down in Puerto Rico because they have seen with their own eyes the outcome and improvement in care and infection control and healing by integrating this product. So what's interesting is, yes, we have a standalone topical that could make dramatic improvements in the lives of diabetic ulcer patients, but it's also an improvement in current wound care protocols when the doctors and nurses actually have understood it and know about the product. It's relatively new still in the market, but when as what we've seen, for instance, in the 2.5 years in the wound care environment across Puerto Rico, is that now it's first line. It's the first thing they grab before they go with any other more advanced care. They'll start the patient on this product, and in most cases, it's an adequate topical formulation to get to the point of healing. So very impactful from that standpoint. Wanted to share a few key statistics around diabetic ulcers because it's quite impactful. And these are statistics that are put out by from the University of Southern California, Dr. Armstrong and his team that focus on diabetic foot problems. They are focused on this. And what has been shown is that there is $1 million spent every 30 seconds on diabetic foot complications in the USA alone. Think about that. $1 million every 30 seconds on diabetic foot complications just in the USA. Every 20 seconds, someone has an amputation, most of them due to diabetes, toes, foot, ankle, leg. And it's crazy. And then if a diabetic foot ulcers, when you have them, it doubles the risk of death and a heart attack risk while increasing the risk for stroke by 40%. All this is around diabetic foot ulcers. So you can see the importance to our healthcare and to our individual family health that when these become a problem and they can start very, very insidiously. I mean, it looks like on a diabetic foot, it may look like a red spot. Oh, I got a blister. I got a little blister. I'm going to treat topically or put a bandage on and I'll see what happens. Well, that's actually the very first step of creating an ulcer underneath the skin and deeper tissues. And then all of a sudden it breaks and you have a full-blown ulcer. So having a tool like this topical that can be used early on. And I want to say one thing also, we've used our APT3X and our formulations with APT for over 8 years in all kinds of settings. No, zero adverse events. Okay. So in medicine, first do no harm. This does no harm, but has tremendous upside in jump-starting a healing process and or preventing progression in a wound development like diabetic foot ulcers.
So, can this be used for burns and other kind of injuries?
Absolutely. So we have found that this, because of the reasons I stated earlier, especially the cell differentiation enhancement in burns in particularly, this is an amazing first step. All of the people who are familiar with it on my team and medical providers, they know that they keep this at home because if you get a burn on the oven or a hot pan, even before you put cold water on it, guess what you want to put on it? This topical APT3X will stop and prevent it from blistering and speed the healing and reduce pain. It now, when you put this on an open wound, like many things, it does sting for a little bit. But what happens is after that goes away, it's speeding the healing process so much that it decreases the pain from many of these, what we call acute wounds, which are sudden onset wounds like burns or cuts and trauma type of things. So yeah, I mean, it can be used on the minor cuts and scrapes, abrasions, like somebody falls on the ground on the concrete and abrades their knee, but all the way to some major early intervention to help prevent wound infections and speed healing.
This sounds like a must-have in everyone's home first aid kit.
Well, it is. I mean, I think that what you'll find is that it could replace anything else like the neosporins or all the other topical antibiotics, which they have their place, but the fact of what this does in all of the key attributes of this topical formulation, there's just nothing else that can expand the efficacy in wound care and burn care like one topical product with this APT. It's quite significant.
So, where do people go so they can order their
Yeah.
own T3X?
Okay. This is our website is good. We are not in retail because we are focused as a small company. We're a small company that is looking to expand and identify partners in the industry. That's what we are. But we have it set on being sold on our website. And the website is aptdeliverysystem.com. And when you go to aptdeliverysystem.com, you can just click on products, and the first one is APT3X that it can be acquired right off the website and mailed to your home. So currently, aside from potentially a medical doctor or nurse at a clinic giving this to you or recommending it, anybody can buy it right off the website.
Well, how exciting is that? Well, doctor, thank you so much for taking the
Yeah.
time to be on the show with us here
And
today.
I'm pleased to do it.
Well, thank you, Dr. Brian Huber. It's been such an honor to spend this time with you and to talk about APT's T3X solution. Make sure to visit aptdeliverysystem.com for more information on the solution and how it can be of benefit to you and your loved ones. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Mary Ann, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.